All right. So let's go back to topic. Okay. So this is the liver. Okay, the stage of liver damage. Okay. So from the beginning, the mild is kind of like a fatty liver. So that's why we just have lots of fat around in the liver, and because maybe your diet and your exercise is not so good. So that's why liver was storage with all this kind of glucagon become like a fat around your organ. So the good thing is that all this fat is kind of become cushion. That's why your organ don't hit each other. Is prevent the damage. But if it is fat is too much, that means kind of like a become uh, like a like a fat is really fat. And then we go to like fibrosis, and that means the liver have some kind of like a damage already, have some kind of like a become fiber and scarred tissue. Then the next stage is become like a cirrhosis. Cirrhosis is kind of like almost in the end of stage. But if we don't calm the liver cancer, so that means what? The cirrhosis means the liver, that part of function is not function at all. It becomes like a hardness. So inside with all the small cell, the liver cell is all damaged. It's all died already. That's why we say it's cirrhosis. So it means it's hard. It's hardness the liver. So when you palpate, you touch it, you can feel the heart. It's not soft anymore. All right. So if I just say actually cirrhosis is the liver died already. So that means what? Basically, the liver function is gone. You don't have a liver function. So remember, one slide we're talking about lots of liver function, right? So you can see here the objective and is here. So lots of things whenever you see the patient and related to the liver function, is gone. So this all become like a sign symptom. So no hemoglobin, because liver can helping produce some kind of like a hemoglobin. And also, they have lots of blood cell. Is big organ. That's why it's hiding inside this organ. Fever, because the liver will also kind of like manufacture with some kind of white blood cell and also antibody. So that means if we don't have this function, of course it causes the infection. Weight loss, because liver is also manufactured with some kind of like protein, will become like albumin, right? And remember, albumin is a protein. We also say albumin is very important. We can hold the water and maintain your blood pressure. And jaundice, of course. So liver will produce the bile, but the bile actually is not going to anywhere. The bile is leaking outside. To the liver is not going into your small intestine directly, so it's leaking. So leaking to your blood, so it will become like your blood carry with all this bilirubin, and it's become like a jaundice. All right, and also the breathing precaution, like have a nosebleed and a purpura and hematuria or hematoma, and the spider anginoma, that means a spider vein. So breathing gum. These are all the breathing because the liver have producing a certain of a clotting factor. And also some kind of like a fibrosis. So that means that all this kind of function is gone. They are no longer to produce clotting factor, just like a hemophilia. All right. So also here is kind of like a very scary thing. So that's why I need to highlight this. The hemorrhage from the esophageal varices is late stage. So that means what? That means all these kind of breathing things and liver is become hardness. So all the blood is backing up. It's not going through the liver because liver is become like a barrier. It's no longer receive the blood anymore. Not so easy. So all this blood backing up to back to your GI system. So going to your small intestine first. So that's why the patient will feel like, okay, I'm not digesting the food very well. I feel nausea and vomiting. Okay, and then we'll go into the upper and the lower GI in a different way. So the upper GI will cause esophageal varices. So this is very scary because when your esophageal have lots of varices, it has kind of like a varicose vein. So when you're eating the food is too raw, will accidentally cut the vein. So patient will have a severe bleeding. Okay. So that's why this is very dangerous. All right. So the bleeding can lead to like a hypoxia, coma, and a death. Okay, so that's why this is a very danger. And also, I forgot to write down something here. It's also the ammonia. Okay, so the ammonia is not going to be manufactured into the urea. So that means the patient is going to deposit lots of ammonia inside the body, which that will cause the patient confused from the beginning, and then will become lethargic, even coma later, will affect to your brain. So that's why this is not good. We don't like it. Okay, diagnosis you can see here by your cell like a serum bilirubin, that means drawing the blood, and also check the LOT and AST, the liver enzyme function, and also the serum albumin. See how much with your albumin still left. Usually not much, right? Because the liver is not functioning. So that's why lots of protein amino acid is not turned to albumin. So that's why they are not be able to hold the water very well. And also lack of albumin, patient actually is malnutrition, it becomes skinny and low albumin. That's why when we give the medication is not binding with all this protein. So if we don't binding with the protein, all this medication is freely just kind of like swimming in the blood. So no matter what, this side effect increasing, all this medication is not function and they cause a side effect. So that's why this is not what we want. All right. So increasing the iron lot and also the cholesterol, decrease the cholesterol level, because liver will use the cholesterol and become the hormone. So that means the cholesterol is not going to become a hormone because the liver is not doing this function. So that will make the cholesterol level decrease. So that's why the patient usually doesn't have like a high cholesterol level in the body. So that's why you're telling me, say, is that a good thing? Because I don't want a cholesterol. No, we want a good cholesterol, the nice cholesterol level still, because we need to produce lots of hormone, right? And also your cell memory also need a cholesterol. So that means what? Patient doesn't have this, and this is not going to function very well. That's why usually the patient liver have some kind of damage. So that's why their hormone, like a thyroid hormone or like a adrenal gland hormone, usually is not function very well. The next one, the medical management. Okay, so we just take a one by one. That's why. So we cannot fix everything. That's why your nursing intervention or medical intervention just one by one. So if the patient is a malnutrition problem, that means the liver cannot manufacture with the protein very well. So that means what? I need to put a diet therapist. Okay, correct their protein problem, right? And avoid the fluid retention or hepatic encephalopathy. That means what? So the liver is becoming a cirrhosis, is not functioning well. So all the blood, the fluid is backing up. So that will cause ascites, which is all the water in your abdominal area. So lots of water in your abdominal area. So that's why we don't want this fluid retention, because this water is the water sit out from your blood vessel. Sit out from your blood vessel, just like what we talked about the last time, like special the venous disease, right? Some venous disease in your lower leg was also sit out the water. So inside the blood vessel doesn't have a water, but outside is edema. So the leg is edema. This is exactly the same. So it just happened in your abdominal area. That's why it becomes ascites. All right. So ammonia will cause the toxicity, right? So that's why going to the brain will become like this encephalopathy. So that means that it's kind of like a poison to your brain, but it's caused by the liver. That's why we say it's a hepatic. So it's a liver happen become like a brain damage. So one of the reasons will cause ammonia is usually we intake lots of protein. Okay, lots of protein diet. So for the protein diet will transfer become some kind of like a amino acids in this kind of like a process will also be used will produce the ammonia. They will become like ammonia. So the ammonia, if they just manufacture go to the urea, so it will be discriminated, will be increased by your kidney. That's fine. But the problem is because before they become the urea, is still ammonia. That's why your kidney cannot excrete the ammonia because the kidney doesn't know that's a poison. Kidney doesn't know, cannot recognize. So this is the reason. That's why. So the diet in this problem, if the patient have a liver problem like a cirrhosis problem, can we get a high protein diet? Do you mean? Do you think that makes sense? They will become ammonia later. But here's also another big problem. The patient also have a malnutrition problem. They don't have a good nutrition. They also lack of protein. Oh my God, this is so dramatic. Patrick, you tell me the patient need a protein, but now you're telling me eating too much protein is going to cause ammonia. What should I do? Do I need to give or I don't need to give? Think about something. Do we need to give or we not to give? Should I
None?
give some protein?
Oh, yes.
Yeah.
Oh, yes.
But if after we get a protein, the liver is not function will become
protein?
ammonia. Okay. So we do have several ways in taking care of this. Okay, like now let's get your note. Okay, get your note ready. So if I know the protein will become like ammonia, so how about I still need a protein, but in this process I don't want the protein become ammonia. So that means what? That means can I use a TPN? Because TPN is already amino acid. It's no longer protein anymore. So that's why patient doesn't need to be digested and need to go through to the liver, right? So the TPN nutrition and they do have amino acid inside. So that's why amino acid will better to transfer to the resource for your body cell. So how about if I also can give some albumin? Albumin is also another type of protein, right? And also it will help to hold the water. That's why we'll correct the ascites. Remember here, the fluid retention from your abdominal area. If I give some albumin, so the water will coming back to your blood vessel, right? So that's what will maintain a good blood pressure, and also ascites will decrease a little bit. I also can do that. All right. So this is the method number one. We can use the ven or use some kind of a pro pig line, and we can give this nutrition. The second thing is, so patients still need to eat, right? If they don't eat, they feel hungry, right? So that's why, okay, I let you eat. But after you eat, if you have ammonia, I need to taking care of that problem. That means what? I don't want your ammonia stay in your body. Some part of the protein will become amino acid, that's fine. But some part of protein, if they cannot become amino acid, they become like a ammonia stay in your body. I do not like it. So I want use a medication to take care of it, to take out the ammonia. So that's why we will use a Lactulose. Lactulose will make a patient have a diarrhea, just poo, poo, poo. Okay, so when the patient they poo by the stool elimination, so ammonia will decrease because the ammonia will go to your stool, will go to your colon, and it's squeezing by your colon. Okay, so that's why doctor will prescribe the lactose every day for this patient, cirrhosis patient. Daily lactose for cirrhosis patient. This is the reason. That's why the patient need to have a bowel movement every day. Okay, be careful of this. Okay, I'm giving the NCAS a super strong hint already. So the doctor prescribed the lactulose for the cirrhosis patient. What is your priority, or what's your expect the nursing intervention need to be happen to this patient? So that means what? Patient need to poo every day, right? They have a stool. I would expect the ammonia should be decreasing the ammonia level. Okay. All right, let's move on. Okay, because another function of a liver is a detoxification, right? Detoxicity. So that means that the liver is no longer to do this job anymore. Okay, so that means that toxicity will increasing if a patient intake something like a medication, like alcohol, or either way like smoking and nicotine, this kind of thing, or some pollution from the food, right? So that means the liver is no longer doing this. So any toxicity is a potential to poison the patient. We need to be careful. So that means what? The cirrhosis patient, sometimes the doctor need to know if this medication is not necessary, we took it out. We do not give the medication to this patient. So that's why you will find out. Even sometimes the patient, they are very sick, but the cirrhosis patient, their medication should be easy and simple, not complicated, because the medication after that like become like a medication toxicity, right? Stay in your bloodstream, so it's gonna damage all your organ, multiple organ. That's why we don't like it. Okay, we don't like it. So some medication for sure is gonna be toxicity for the liver. So later on we need to talk about that. So that's gonna making the patient even more easy to get poison. Okay, so I have one slide of that. So that's why that's the NCAS superstar medication. So that's why you need to know. So what kind of medication we need a liver function because it will damage you to the liver. Okay, so during this nursing intervention, of course the patient will feel like a nausea, vomiting, right? Because this is a GI problem, right? Diuretic we need it because of fluid retention in your abdominal area. So sometimes we need to give some diuretic. Why the fluid retention in your abdominal area is such a big issue? Ascites is one issue for effect to the vital sign. What is that? What happens if we just keep building up the fluid in your abdominal area? The fluid is
They
given
can
more and more.
rupture.
Huh?
They can rupture your intestine.
Not rupture. Think about the pressure is going upper. It's going up. So what will happen? The effect to one of the patient's vital sign.
Hypertension.
Heart, blood pressure,
Not a heart, another organ.
respiratory,
Yeah,
kidney?
the patient cannot breathe very well because the
Oh,
lung cannot
lungs.
fully extend. Because remember your diaphragm is there, right? So that's why they are compressed. The diaphragm going higher, is just going upper and upper. So that means the diaphragm is not be able to pull down all the your lung. The lung is not fully extend. So that's why patient is going to tell you, okay, I have a shorter breath, I have difficult breathing. But when you check in the patient, you find out I feel like your oxygen saturation is okay, but why you're breathing difficult? Well, one of the reasons is because all this water is pushing all the pressure going to your lung. Yeah, push the water pressure to the diaphragm. So this is the reason. That's why we use a diuretic. So actually, this diuretic is not helping to the heart; it's helping the patient breathe. Okay, we good? All right. Vitamin. Let's talk about vitamin. Okay, I didn't write down any vitamin, so they you need to put it down. Okay, by yourself. Okay, so if a liver is a cirrhosis, okay, there's a certain vitamin for sure this patient need to take. They need to intake this vitamin because liver is not doing the function. That's why the patient will lack the vitamin. Okay, that's one by one. Let's think about something. The liver is not be able to making a very good coagulate with the blood. Okay, so that means what? The patient is actually hemoglobin low. So what kind of vitamin patient need to take?
Iron,
Iron and also probably B12, right? Sometimes B12 maybe also help. Even the B12 is for the stomach, but sometimes B12 and folic acid will help, right? Okay, good job. The first one is a blood. We're taking the vitamin for the blood. Okay, let's talk about the second one. Okay, this patient have like easy to bleed. Okay, easy to bleed. So that's why we cannot give an anticoagulant. But what kind of diet is going to be good for the patient for this problem? Our vitamin. I don't want patient to bleed. I want patient have like a beta coagulant. Okay, so that means what? I need to give the beta vitamin K food, right? Remember this? Yeah. So that's why we inject the vitamin
Leafy
K.
greens.
Huh? Green, yes,
Is it
yes, you're
leafy
right. Yeah,
greens?
the
Yeah.
deep green beef leaves. Yeah, so which is like what kind of food? Like a kale, spinach, like a broccoli. Yeah, this kind of food. Okay, this kind of food. The very deep green vegetable. Yes, so it will help. Is have a better vitamin K, and also if it's not enough, we can inject the vitamin K injection. Okay, this is your knowledge number two. Okay, the vitamin. Okay, then I can talk about the next one. Okay, let's talk about is what kind of a vitamin the patient also need to take. Think about something. The liver
vitamin
is
D,
not huh? Liver is not
vitamin
function.
D,
I cannot hear. Sorry, I was talking.
I'm sorry, vitamin D.
Vitamin D, yes. Yes, thank you so much. Because the liver will helping the vitamin D absorption. But now liver is not doing its job. Even you expose the sun and you have a vitamin D created in your blood. But nobody is doing this job. So probably I need to just take some vitamin D, right? And well, not actually it's opposite. So vitamin D is helping your calcium absorption for your bone, but the liver is not doing for the vitamin job anymore. Vitamin D job this job anymore. So that's why you intake with all the calcium is not helping at all because you're lack of vitamin D. So that's why you take the vitamin D to helping your calcium prevent osteoporosis and fracture. Very good. Okay. And anything else you think? That's not this is not a vitamin. Let's talk about electrolyte. Okay, what kind of electrolyte and you think this patient need to intake? We have like several electrolyte only. Okay, the easy one, calcium, potassium, and also what else? The sodium and also magnesium. Yeah, usually we don't talk about two other very detailed mineral like electrolyte. So think about which electrolyte this patient may need. Okay, the first thing is a fluid retention. Okay, can we take the sodium?
No.
No.
Maybe it's not a good idea, right? No. So that's why this patient will need a low salt food. So how about the potassium?
Yes.
Yes. Because most of the potassium should be remain inside the blood, right? That's why your body and your organ will take the potassium from the blood. But all this fluid is leaking out from your blood vessel. That means all this potassium is becoming like excited, becoming like retention in your abdominal area. So that's why the patient actually is lack of potassium. So that's why we need a potassium supplement for this patient. Okay, very good job. Okay, did you copy all the thing here? Okay,
Yes.
Yes.
all right. This is all your NCLEX. Okay, NCLEX doesn't tell you directly. That's why your textbook just says something like this. That's why I'll give you a very strong hint. All right. So because a scientist, lots of water just retain in your abdominal area. So unfortunately, if you don't take it out, it's gonna affect patient's breathing, right? Patient cannot breathe. So that's why we need to do the procedure is a paracentesis. That means put a long needle in your abdominal area and we withdraw. We aspirate out. Okay, take it out. Extract water from the abdominal area. That's why this is paracentesis. Okay, but before we do the paracentesis, the patient need to be on NPO. Okay, this is very important. So we have another centesis is a SORA centesis. We put a long needle to your lung. Do you still remember? We do it on the back. So that's why patient was leaning forward. Do you remember the picture I showed you the last turn? Right, that's a SORA centesis. Okay, SORA centesis and paracentesis. Does the SORA centesis need to be on NPO? Yes or no? Think about it.
Yes?
Yes. And
No.
No. The answer is
No.
no. Because it's not related to any GI. So when you do the SORA synthesis, usually patient doesn't vomit. It's not cause the aspiration. So that's why SORA synthesis, it doesn't have to be NPO. Some doctor will put NPO, but no, it's not a requirement. But paracentesis for sure, 100% is doing the procedure to your abdominal area. Is on your GI system. So they need to be on NPO for sure. Okay. All right, so after you aspirate with all this fluid and the patient should be improvement. So that's why the NCLEX is asking you, so what kind of significant change or improvement you're going to see the patient after the paracentesis? After we aspirate, we draw all the water out already. That's very easy, right? The reason I'm doing this because I want to take out the water, right? And one of the reasons is the patient cannot breathe. So that's why I would expect the patient, the vital sign, the breathing is getting better. right? That's very important. The patient breathing is going to get better. Okay. All right. The next one is esophageal varices. Okay, so I will show you a picture. Okay, so this is kind of like when your portal vein is backing up with all the blood and fluid going back to your GI system because that goes through to your liver because the liver become like a rock. It's a hardness, nothing can go into. Before the liver is kind of like a sponge. Okay, so that's why the sponge all the water can go through the sponge, right? But now liver is now no longer like a sponge anymore. So that means all this blood going backward. So that's why your vein is become like an enlargement and also a varicose vein. So here is something very important is if it is a laceration or some kind of like hemorrhage, it's kind of like very dangerous. Patient will come bleeding to die. So you need a surgical intervention for sure. Okay, for sure, like a ruptured esophageal varice is kind of medical emergency. Let's see the picture here. Okay, so I have two picture. This is picture number one. Okay, you can see the liver is all kind of become a hardness. Okay, that's why the portal circulation, the portal vein here is all backed up. Do you see all this blue vein, right? Is backing up, and all this kind of small vein, all the blood is backing up with all the stomach and also your esophageal. So that's why your esophageal become this kind of like a varicose vein. Okay, when you open the bigger picture, you can see the small varicose vein like this. Okay, in your inside stomach and also inside esophageal, outside and inside, they both like this. They both like this. You can see the vein is kind of like this, right? It's a little bit popping out, a little bit like aneurysm. But when we learn aneurysm is an artery, but this is the vein. Okay, just like something popping out like aneurysm. Okay, let's see the next one. So this is the kind of like all this kind of like the vein in your GI system, the portal vein is going to affect it. So if the blood is not going to your liver, okay, it's backing up. So that's why your stomach, upper GI stomach, esophageal, and then go to your spleen. Okay, on the right side, the spleen is also becoming like enlargement because all the blood coming back. Also, eventually later on, it's going to cause both kidney. The kidney also is going to have like a backing up with lots of blood. That's why kidney was kind of become like we say a hydronephrosis. So I will talk about hydronephrosis. It means that all the water coming back to the kidney, and in the lower part, your colon and also intestine, all the blood backing up. So that's why they have all this varicose vein here is not absorb any nutrition anymore. Okay, the nutrition is not going through to the vein because it is all back up. So that's why it causes the patient have a nausea, vomiting. Okay, nausea, vomiting. And also the varicose vein is backing up. So that's why go to your umbilical. So umbilical will become like a hernia because this is kind of like a weakness part of the skin, right? Will be popping out, become a hernia will popping out. Okay, but this one is not a medical emergency. That's fine. All right. So you know this. Let's going back to see the picture number one. All right. You see the esophagus here is all like this, like a small things like a vein. So this is fragile. Unfortunately, if you just cut a little bit, they will start to bleed. And this is so many. So if everybody is so many just being cut or just being ruptured together, so what will happen? Severe bleeding. Okay, because we don't have anything can heal here. Nothing can heal. And also close the bottom part. This is stomach acid. Oh my God, this is so drama. Stomach acid also will cause this kind of bleeding and also even more severe. Worse and worse. Okay, so this is the reason. That's why this is a medical emergency. Okay, the patient is going to cause bleeding and until they die. So that's why this is esophageal varices, and that's why this is, we need to control and manage it well. And that's why make sure patient they are not going to rupture with their varicose vein. Okay, so you have this idea. Let's going back to talk about this. Okay, so surgical intervention is needed because the medication just only control, but it's not going to be cured. But we want to prevent all this complication. The best way is doing the surgery. So the surgery, the doctor have a several way. Either way, I just kind of like a burn or just a heal and making a scar tissue on the esophageal vein there. So that's why it will heal and totally block with all these esophageal various vein. This is the number one. Another number two is the doctor will basically tell you, okay, let's just cut the whole part of the esophageal. That means what? That means that just like we have a cancer, we just cut the whole part because I don't want if one day you bleed and you just die immediately within 15 minutes. You are not in you cannot catch the time to the emergency. You die on the way already. So that's why doctor will cut all the esophageal away. All right, but this is not taking care of a problem with the lower GI too. It's just kind of like something we try to prevent a little bit better. Okay, still have lots of problem. But here, as a nurse, they're asking you, the nurse, how can you do the intervention for this patient? Because you are not the one doing the surgery, right? They're asking you, how can you take care of the patient is already diagnosed with the esophageal virus? How can you take care? So as a nurse, I want to prevent hemorrhage, right? I want to prevent the rupture, right? So that means the food, the diet I choose for the patient is going to be very, very important. I want to make sure the food is not irritate to these veins. I want to make sure the food is not cause a rupture. Okay, so that means what? The patient is not allowed to eat a big piece of food. So all the food need to be cut. So that's why not a big piece of food is kind of like pass through your esophagus and unfortunately will cause rupture. Because can you imagine? So esophagus is kind of like a tube. If a food is too big, they need to just put all the food down to your stomach. So that's why they will squeeze. They will being like very usually all the pressure so hard to squeeze, and they will cause various then rupture. That's why we don't want it. So that's why the grounded food and the chopped food is good for the patient. The second thing the patient need to choose the food is a no raw food. That means what? So if this food is too dry, or the food is uncooked, or the food is including the bone or some kind of like the animal's skin, and we do not give the patient. Okay, why? For the bone, of course, the bone have like a biggest problem is going to cause a rupture, right? So you can see United States is pretty good. So no matter like chicken, the beef, or like the fish, even the fish, they take out all the bone already. Because from the beginning, it's for the pediatric consideration. Because the kids will swallowing the bone and it will cause the GI problem. That's why they don't want this to happen. That's why they take out with all the bone. And another thing is because the patient have this kind of problem and the cirrhosis. Remember, in this country, lots of people, their life is not so good at drinking. That's why it causes the esophageal virus. So this is the reason that's what causes the rupture. That's why we took out the bone. All right. And the second thing is that the food is too dry. Okay. So we don't let the patient to eat. Just like I told you, okay, if a patient just want to eat some piece of bread, for example, Uncle is asking you, okay, the patient, the family just bought like the 16-inch of a French baguette. Okay, and they just patient want to take one slice of baguette to eat. Is that okay? No, that's too dry. I don't want you swallow the dry food. So I want to make sure you just swallow it with the wet food and a small piece of food. That will be better. So that means what? If a patient really want to eat this kind of like a food, like a dry food, like a bread, okay, make sure you just sucking into some kind of liquid. Like I don't care what kind of liquid you want to put in the water, and the NCLEX is recommend sucking in the soup. Okay, in the soup. So that's why you can taste the soup and then also the bread together. That's okay. That's good. Okay. So NCAS one time asked the student. So the patient have like the family just having the patient cut some small piece of a steak already. Okay, but consideration the patient swallowing problem. So what kind of the extra food you can helping the patient to swallow smoothly? Okay, so that's why NCAS give you several choice. So can the patient just eating this kind of small piece of steak with the water, or with the soda, with the wine, or with the gravy or the cream cheese? Okay, which one is okay? Which one is not okay?
With the gravy?
With the gravy, yes, that's good because it's wet, it's easy to swallow. Yes, or like a cream cheese is already kind of milk already. That's good. Okay, so alcohol for sure is not can stimulate. So drinking with the water in the between, okay, but we wish you can just soak into the water, make the food even more moist and more soft. This is what we want. Okay, so if you are not putting this and it doesn't count, that's why NCLEX say, okay, drinking the water in the between. No, I don't want it. Yeah, that's the better choice. Okay, drinking the soda, no, no, no. Okay, no soda. Okay, now do you have more idea like this? Better idea? Good. Okay, this is the food we choose for the patient. Okay, and also the food we choose for this patient is easy for swallow. That's why not too cold, not too hot. So that means what? A little bit ice cold water, that's fine. Not whole full of ice water. No. Okay, that will trigger the patient have like a spasm. So when they have a spasm, that it could be caused a rupture. Okay, that's why we don't want it. All right. And also, when you drinking some kind of like a stimulant food, and sometimes the patient doesn't feel comfortable, they will cough. So this patient esophageal various patient, we don't want them cough. Again, we don't want them cough. One more time, we don't want this patient cough. So that's why you'll feel like, okay, sometimes coughing is good, right? Because it's tend the lung. Yes, but the problem is that coughing is also increasing the inner pressure. So when the inner pressure increasing, so esophageal various, so it's going to be ruptured because it's the pressure. So that's why we don't want this patient to cough. So NCLEX is asking you, if this patient have this diagnosis, esophageal various, okay, so we want to prevent the flu season, the patient, we don't want them to cough. How should we do? I don't want a patient get sick. I don't want a patient cough. So like a flu shot or pneumonia shot is good, right? So that's why it's
flu shot.
yeah, that's good. So how about others? So if unfortunately patient is sick already, what kind of medication I can give the patient? Easy, don't think too much. Coughing medicine, right? Coughing medicine. So that's why I will give a patient coughing medicine for sure, right? So they just tell a patient, okay, I don't want you to cough, okay? So if you cough, it will increase your pressure. Okay, how about below the nose? If the patient have a runny nose, below the nose. No.
Decongestant.
Decongestant medication. Yes, thank you so much. We can suction the patient. We can use a decongestant medication. Okay, I'll tell your patient just gently use the towel to wipe yourself. Do not blow your nose. It also increase the inner pressure. I don't like it. So that means that your various various vent is going to be ruptured. We don't want it. Okay, so you have a better idea right now how can just helping the patient for this part. Good, right? Okay, so the next one is a gastro lavage. Wait me a second. Okay, wait. Hugo, going down. Get down. I'm busy. Get down. Hey, get down. You both get down. Sorry, my dog is missing me, so keep barking. All right, let's come back. So the gastro lavage. Okay, so remember what does that mean? Gastro lavage. We put a tube inside the stomach, right? And we irrigate, wash out, and also aspirate out. Okay, so remove the swollen blood from the stomach. So that means what? Once if the esophageal various is ruptured, have a lot of blood layer. So we need to remove the blood. Okay, not just having the blood just staying there. And why we don't want the blood stay in your stomach? You're probably thinking about it's weird because I say blood stay in the stomach. Okay, so how about if I change another way to say this? Why we don't want any fluid in your stomach? Blood is a fluid, right? Okay.
Aspiration?
Yes. Good. That's a good guess. You're right. You catch it already. Very good. Critical thinking. Because you know what? So whenever any kind of like the fluid in your stomach and the patient is in emergency, patient maybe will unconscious very soon, right? Think about this patient. It's gonna be a hemorrhage shock. They lose the blood, the hemorrhage shock, the patient is gonna be unconscious immediately. So that means what? It's increasing the aspiration. So that's what I don't want to happen. So I can save the patient for the breathing, but then patient choke, they die. So that's kind of very silly, right? I still did not save the patient. So that's why, how about I just put a tube right now? If I have some kind of extra blood, I suction out, right? And also the reason we put a tube, we suck out the blood, we can do intake and output. Have you think about that? Intake and output. So when a patient swallow into the blood, I don't know how much blood loss, right? I have no idea at all. No. But if I can suck out certain of blood, I can kind of guess a measure how much the patient lose the blood already. And also I can see the blood's color, right? So that's why in that time, I can have a better idea to let the doctors know, you know what, we better just call the blood bank. We need to replace the blood. Okay? So let's talk about the blood, calling the blood bank and replace the blood. So this is also another big problem. So whenever you have a patient have esophageal varus, this kind of diagnosis, so you need to get one concern done. You need to get one exam done. What is that? We just talk about it. Blood.
The ABO?
Yeah, blood transfusion concern. I need to know the patient's blood type. I need to draw the blood. Because if the patient have like a high potential, is going to lose the blood, right? They're going to losing the blood. So I cannot let the patient die. So I need to get the AVO done first. So that's why let's see. So what's your blood type and your blood cross matching. So after that, I can call the blood bank immediately. The blood bank will give me the blood immediately because I done this already. I don't need to, especially when the patient is aware and alert. So that's why I let the patient sign a consent. That's why. How about if the patient is Jehovah Witness, right? They cannot receive the blood. You say, oh my God, shit. So what should I do right now? How can I know if a patient is Jehovah Witness or not? Patient is unconscious right now. And nobody is here, no family member, right? Okay, good critical thinking. So that's why this slide actually is talk about so many things. The next one, this is kind of liver cause the brain damage. Okay, brain damage by the liver disease because of what? Ammonia intoxication. Ammonia level is too high. So the treatment is supposed to prevent further the liver damage and also for the brain damage. Okay, so whenever you feel that patient is kind of getting a bit confused, what's your nursing intervention? Your suspicion that maybe ammonia level is high. What happens if a patient is confused? I'm not saying like unconscious yet, okay, just a little bit confused. So you need to do some assessment, right? So in the term 4, we're going to do lots of neural assessment, but you also can learn it right now because you're in a clinical rotation right now. So that's why try to identify the patient level of conscious and how many still left. Okay, what kind of confused? So also the safety precaution. Patient is confused. That means the patient is easy to get damage. So patient maybe fall, or patient maybe will go to outside your unit, will get lost, right? Or patient maybe will use something kind of like a hazard, maybe will cut their cell or they will damage to their cell. They don't know because they are confused. Okay, so that's why safety precaution is necessary. If a patient try to remove all the medical equipment, like remove the IV, remove the like this, gastro lavage, the NG2, so maybe we need a seater for the patient, right? Okay, so this is one thing you can do the assessment. Can you call the doctor to get the lab? We need to. Why? The patient is confused. They have this cirrhosis.
Infection?
It could be infection, but now we are talking about ammonia level. So that means what? So patient ammonia level maybe is high right now. So let's tell the doctor, can we just have a lab? We draw the blood to see how much ammonia right now. Yeah, if ammonia is really high, I need you give me the medication or do something first. Okay, if a patient is unconscious, of course they cannot drink the Lactose, right? They can't. So that means the patient need to go to the emergency. We have IV fluid to helping the patient, or even sometimes the patient need to go to the dialysis, because the dialysis is not just only for the kidney failure. Dialysis actually is clean out with all your blood, including you have some toxic blood. So that's why dialysis will help out. So that's why probably we need a doctor put a dialysis order. So that's why let's just do a dialysis, helping the patient can wake up later. Okay, good. Avoid like over-the-counter medication, also alcohol. Okay, we have one slide here. Here. Okay. Hepatotoxicity medication. Lots of medication you learned already. So we are going to review. Okay. The first thing is, of course, the Tylenol. This is over-the-counter medication. So Tylenol and ibuprofen and aspirin, NSAIDs different. Tylenol will damage to your liver. Okay, so the NSAIDs, that means the aspirin and ibuprofen, they will damage to your stomach, your GI. They will cause the ulcer. Okay, so that's why this is totally two different things. So that means that when you know the patient the liver function is not good, please do not give Tylenol. You can consider give an NSAID. Okay, maybe give some aspirin. That's okay. Just remind the doctor, hey, you know what? The ALT, AST, the level is high. So why we still give a patient Tylenol? So doctor maybe will switch to another medication. If I find out the patient actually have a stomach ulcer, of course we don't use the NSAIDs, right? But patient is complaining about, I have a pain, so what should I do? So if I'm not in the hospital, I'm home. There's no narcotic medication for me. I don't have a dilated morphine. So let's tell the patient, you know what? Tylenol will help you, okay? Because Tylenol is not stimulant to your GI. So that's why this is your medication knowledge, okay? Tylenol is damage to the liver. And also antibiotic, okay, like augmentin, amoxicillin medication. Amoxicillin medication will damage to your liver. Okay, augmentin is a medication in the pediatrics we use a lot for the kids that have like an ear infection. Okay, sometimes the UTI patient will also use augmentin. All right, and flucloxacin, and also erythromycin. We learned erythromycin before for the organ disease, the heart disease, the streptococcus infection, right? So this is also damage to your liver, all right? And the sulfa medication, SULFO, sulfa medication, this is also damage to your liver. Azithromycin and cephalosporin, okay, this is all damage to your liver. Antifungal medication, we have one medication very famous, we learned already, Diffucan. This medication is treat the yeast infection in your oral candidiasis. Remember this one? Diffucan. We have an exam already. Okay, so this medication will damage to the liver. That's why remember is the number one question I tell you. Okay, this is extra knowledge. So we need to check the liver function. And also the medication we learned already, statin medication, like atorvastatin, like a Lipitor, or Crestor, and also Zolcar. All these statin medication will damage to the liver. Okay, the next one. Yeah, TB medication. All the TB medication, every TB medication, 4 TB medication, they all damage to the liver. See the next slide. You remember all this? I put it back. Okay, so the TB medication, the first one is INH, right? So cause the GI upset, hypertension, hepatotoxicity. Rifampin, hepatotoxicity, okay, is sesmobutyl, okay, hepatotoxicity. Pyrazimide, this is a hepatotoxicity. All the TB medication every medication is damage to the liver. All right. And then the benzo medication, the benzodiazepam, okay, like a lorazepam, Ativan, diazepam, your Valium, okay, something like a Zepan. This is benzo medication. They all damage to the liver. Okay, then the anti-seizure medication. Okay, you're gonna learn that this very famous seizure medication Dilantin in the term 4. So that's I just remember right now. Okay, very famous medication Dilantin. This is the anti-seizure medication. Is damage to the liver. Phenylating. Okay, the trainer is Dilantin. Also, some kind of immune suppressant medication too, and of course, alcohol. We know unknown drug and herbal tea. Okay, so it's cause liver damage potentially. Any questions so far? GI is a lot.
No.
GI is a lot. Okay. Yeah. Okay. Good. Okay, we finished this one already. Let's go back to this one, the cirrhosis. Okay, nursing intervention. Okay, checking the vital sign every 4 hours or for more if a hemorrhage is presented. So that means what? If for sure you know the patient is already have some kind of bleeding episode, especially in esophageal. Okay, that's why we need to check the vital signs, see if any blood pressure is going down. GI hemorrhage. Okay, like a patient is vomiting the blood. So if the esophageal is kind of like a broken and a rupture, so when they vomit the blood, it's kind of like a bright red blood. Okay, not like like a GI ulcer blood is kind of like a coffee ground. That's different. All right, anxiety or restless. That means what? The blood pressure is going down already. So patient maybe is kind of confused already. No perfusion to the brain because it lose lots of blood. Okay, so maintain the balance, well balanced. Okay, moderate. She has high protein. Okay, do not directly give a protein. I say high protein means sometimes giving to blood. It doesn't mean the patient will immediately just take a high protein. Okay, so remember this is a little bit different. So this high protein could be like a TPN, could be albumin. It doesn't mean patient will eat. Okay. So that means if unfortunate patient cannot take a very high protein by their mouth, high carbohydrate food is acceptable with adequate vitamin. They also need to take the vitamin we just mentioned about. Okay, the alcohol abuse, they better stop the alcohol drinking. So although the mental status change because of what disorientation, headache or lethargy, okay, and also if a patient tell you I feel tired, tired is kind of like a mental status problem. Okay, so that's why you also need to know tired means so many things. It could be medication, it could be the disease, blood pressure, the vital sign, also the brain disease. Okay, be careful. Jaundice. So that means what? All the bilirubin is not going to your GI system, is seeking out, going to your blood. So that's why the skin will become like yellowish. Okay. Also, because the bilirubin is in your blood, will circulate, go to your kidney, mix with the urine. So that's why your urine will pee out with the bilirubin. So that's why dark urine is possible. And because the bilirubin is not going to your GI tract, so the bilirubin is mixed with your bile together. That's why your bile will dye the stool, making your stool become brown color. Because we don't have another bilirubin is sit out to your blood vessel, not in your GI. So that's why your stool will no color, will pale color. So that's like a gray color or pale stool. All right. The liver cirrhosis, first, this is no cure. There's no cure at all. Nothing we can bring this liver back. The only thing is for the patient's help is the liver transportation. They will get another new liver from another person if they donate to the patient. Okay, that will become like the organ transportation problem. Okay, so let's remember this. No cure. That's why your intervention is prevent further damage. All right, you can see. So this liver damage is all excited. See, this belly is become so big. The patient is not fat. Oh, he's not fat. Is excited. And also, you can. Did you see his abdominal area have some kind of a spider vent already? Some ecchymosis and with some kind of a vent is almost going popping out. Yeah, this is going to be the spider vent later. Okay, and this is why we show you. Okay, the liver cirrhosis in the surgery room is just like this. It becomes like hardness. It's not like smooth and shiny anymore. It's not. It's become like ugly. Okay, then PV treatment. All right. The liver cancer, okay. So the cancer, nothing we can do. Chemotherapies and surgery or radiation, okay. Usually liver doesn't really do the radiation. So most likely it's a chemo and also surgery. Most likely the radiation is very rare to the liver cancer. But anyway, also because the liver cancer is no cure, so that's why we try to do some prevention and to prevent the further damage. So this is the reason that's why we use the chemo and also the surgery. All right. So for the liver cancer, they'll have some kind of a risk factor. Okay, the risk factor NCLEX like to asking you a lot. Why? Because you work in the medical field, they want you to know how to protect yourself. So one of the biggest risk factor is a hepatitis. So hepatitis B and hepatitis C. Okay, I highlight here. All right. Hepatitis A, B, C, D, E. Okay, hepatitis B and C is a little bit majority, especially hepatitis B, majority and happen in the healthy care. If unfortunately we have a blood contaminate each other. So that means what? So if you draw the patient's blood and unfortunately the needle doesn't poke yourself, you get poke, the needle stick, and you probably will be contaminated with the patient's blood disease, right? So what is a hepatitis? Not just only HIV, okay? Just let you know something very important. HIV, the AIDS medication, we have very good medication right now, so that's why patient can live almost like a symptom-free. But the hepatitis is more scary. We don't have a medication for that. We don't have really medication for that. We may have some medication for the hepatitis C right now, but not a B. So that means what? If you have a hepatitis V, so you need to be careful taking care of your liver because it will become like cancer very easy. So this is the reason that's why we want to make sure all the nurses, you need to verify the patient's disease, right? And also a standard precaution. If I don't know this patient's blood have something wrong, when I need to touch the blood, I need to protect myself. Okay, wear the glove, wear the gum. Okay, I don't want blood spray on my body. Even wear the eye goggle or the face shield. Okay, so if you want to draw the blood or you want to touch the patient's blood or urine or feces, something like this, the highly contaminate. If you don't feel comfortable, you can double up the glove. Okay, double glove. That's fine. That's okay. All right. So even it's not become like a cancer, become like a cirrhosis is also very easy if you do have a hepatitis. Okay. So when top of the liver cancer, liver is some kind of organ. Very very funny is the cancer doesn't stay in the liver only. If you do have liver cancer, the cancer cell like to go out from the liver. Yeah, just like your teenager. Before your kids become like a teenager, they stay with you at home all the time. Since they become a teenager, they break you up. Bye, mama and papa. Bye bye. So they just go out, making their own family. So liver cancer is just like this. The cancer cell like to travel and abandon the liver, original liver cancer. So that means metastasis rate is high from the liver cancer. So usually liver cancer metastasis will go into your esophageal cancer and also brain cancer and also lung cancer. Okay, this is couple cancer usually. Just that you know. All right. So the diagnosis is kind of liver scan and MRI and biopsy of course, especially biopsy is most accurate one. Okay. And how we taking care of the liver? If not all the liver is all cancer, we just cut some part. We call this lapidotomy. Oh my god, this is a Latin word. I really have hard time to pronounce. Anyway, just cut some part. Is a lobe. Okay, is cut some part of the liver only, like this. Okay, so if this part just only have one part, have a cancer, which is cut this part. So the remainder of the liver still can function. It still can function, but the function is not going to be like 100% like before anymore. Okay, so this is the reason. That's why the doctor will evaluate if this liver still can use. That's why they will cut some part of the liver. If not, they will tell you, okay, basically no hope, or either way you can wait for the liver transportation. All right. So this is the liver anatomy. Okay, you can see all the different stage of the cancer. All right. Yeah, discussing. Okay, hepatitis. So hepatitis is also another big problem we need to talk about in the healthy care and prevention. Okay, prevention is the best treatment. That means what? As long as you don't get it, you will never have this kind of similar disease. All right. So let's talk about hepatitis. So hepatitis. I remember I have a chart. Do I have? Oh, I do. Good. Here, let's do this first one. Okay. The hepatitis A, B, C, D, E. Okay. Their passage and also the transformation is different. It's different. So that's what I want to tell you. Okay. The hepatitis B, C, D, it is 3, is by the blood and also body fluid. Is prenatal. So that means what? Like a sex, or like a sharing the needle, or like a mother to the baby. So for this, like a transmission exactly like HIV. Exactly. Okay, like a patient sharing a needle have a drug abuse. So that's why hepatitis B, C, D, they will get it. Okay. Hepatitis A and E is different. It's a fecal to oral. That means what? Injection, that means that eating like dirty food, like a pollution food. Okay, especially like now it's the summertime, right? When you go to the restaurant, you have like a food poison. Unfortunately, you get a hepatitis. Usually, you get a hepatitis A and E. Okay, so that means hepatitis A and E, they do not transmit to other people. They don't. Okay, so that means what? If a husband, unfortunately, just go to the restaurant, have like a diarrhea and have like a get sick for the hepatitis A, get treated, do you think the husband will transmit all the disease to his family? No. The answer is no. He won't have this kind of problem to his family member because it's not a B, C, D. It's different. Okay, so A and E is not going to become like like a communicable disease. It's not. But in certain of our area, for example, like you tell me you going to some kind of like a non-well developed country like India or like a South Africa, some part of that. So their living style is not so good. Maybe the food is kind of dirty. So that's why you get hepatitis A and E is very easy, right? So this is the reason. That's why before you traveling to other country, so that's why the CDC will recommend you to get a vaccine first to prevent the hepatitis. Okay, not just only hepatitis A and E, also vaccine good for hepatitis B, C, D, because they don't know, they never know if you're gonna have sex with some people there or not. So that's why they will prevent all of this. Okay, so that's why one of our prevention is a vaccination. Remember this, okay? Another picture is showing you a little bit more clear. Okay, so that's why you can see. All right, so the hepatitis A, usually we talk about ABC, the D and E is what happened in the future. We add up. So ABC, A is a fecal to oral, that means dirty food. And B and C is from the blood for sure, and all sex, or just have like body fluid contact. Okay, so you can see here in A and B and our E. So we do have a vaccine. Okay, hepatitis C doesn't have a vaccine yet, but they have a medication, can treat the medication very well. So that's why I put this picture for you. All right, let's go back. Hepatitis. So when you get sick from the hepatitis, of course, you can cause an energy because the liver is getting failure. So that's why patient will tell you, okay, I feel tired. Okay, so whenever you have like a lung problem or heart problem, our kidney problem, our liver problem, our brain problem, usually patient will tell you, I'm lack of energy, I feel tired. So this is expected. All right. And also here, another thing is that build up the biosalt or bilirubin under the skin, because remember, this kind of thing was sit out from your gallbladder and also liver going to your blood. So that's why your blood bring all this biosalt or bilirubin everywhere and will deposit under your skin. So that's why will cause patient have itchiness. They feel itch. Okay, itch. They are yellow, they are jaundice, and also with itch. So that means what? We might can give some lotion, but usually it's not helping, because this itchiness is from inside the body, is from the blood, it's deposited under the skin, it's not on the skin. So that's why the doctor usually will put the Benadryl. Okay, the Benadryl antihistamine can just reduce the itchiness. So if you get a Benadryl already, the patient still feel itch, what should we do? How can we decrease the itchiness by the nursing intervention only, not by the medication? Ice pack. We can put on ice pack. Like a cool towel. Tower. Okay, so that will decrease the ice will decrease lots of itchiness because we numb the feeling already. All right, so it will also cause a hepatomegaly, so the liver will become bigger. But the problem is because they now digest the protein very well, that's why weight loss, the same, and the jaundice. Okay, and because all this bilirubin and also biosalt in your blood, that's what cause the urine become like an amber tea color, dark urine. It's dark urine. Okay, here, prolong the PT and iron up because the significant liver get damaged already. That's why the clotting factor is not good anymore. All right. So here is a problem. So if unfortunately I got a hepatitis B, especially hepatitis B. Okay, I got infected already. I want to control the symptom because now vaccine is too late. It's no longer use the vaccine anymore. What should I do? I got infected already. So I want to reduce the symptom. I can get a gamma globin. So this is immune serum globin. It's immune serum globin, gamma globin. So that's why we can give it to the patient and reduce lots of symptoms. But here, the gamma globin, I need to ask you another question, which is this picture. Remember this picture? Then active and passive immunity. Okay, so the gamma globin is belong which group? Is it passive or active?
Passive.
It's passive. So is a natural or artificial? This one. Gamma globin,
Artificial.
yeah. Gamma globin is artificial passive immunity. So that means what? This kind of like an antibody. So we just give it to the patient directly because the patient didn't get the vaccine and unfortunately they get infected by the hepatitis B. Okay, that's why. Let's give them the antibody directly because no timing is no time I can create the antibody anymore. So that's why I just directly to give the antibody. Okay, antibody. All right. Remember, you're learning from Lisa right now. Lisa maybe is going to asking you this question again because we have one famous medication for the OBGYN. It's called Rogaine. Okay. So when the mother is born with the kids is RH positive, RH negative. You remember that slide? I tell you, I'm not going to test you because it's the maternity. But Lisa will test you right now. Okay. So remember this picture. Okay. All right. So that Reagan medication, the injection is also artificial passive immunity, because that Reagan is actually a antibody. Is antibody. So it's artificial passive immunity. Okay, the medication. All right. So prevent the transmission of the disease is very important. Okay, for the hepatitis patient, like A and E, is kind of oral to fecal. That means what? Contaminate, especially the food. So that's why we don't want the patient sharing the item together, like the food, like a tray, like a utensil. Okay, the towel and also the toothbrush. No. Okay, but for sure, BCD is by the body fluid, also blood. So the patient, they can share with the same toilet and the same shower restroom is no problem at all. But a personal item like a razor or like a toothbrush, no. We don't do that. Okay, they use their own. We use our own. And also the towel. Towel is okay, but we still recommend the towels just separate because you don't know if it is a wipe and seal they have a blood or not, right? Yeah, you just don't know. You're gonna wipe the blood in your eyes, something like that. Okay, so this is very important information. NK is asking you, can they share something together? Can they live together? Can they just take swimming? Can they take a shower or doing something together? Okay, that's why hepatitis usually the A and E is not effect to the family, but we don't want them share all the item from the beginning, especially the food, the E, the utensil. Okay, and the B, C, D living together, no problem, but not sharing with some kind of personal item. Okay. Okay, and then of course, personal hygiene is also very important, right? Why? Because washing your hand, personal hygiene is like washing your hand. So that's why make sure the hepatitis A and E, so it's not going to be eating the bacteria, is not eating to your GI. Okay, wear the gun and the glove, standard precaution. Okay, so hepatitis A, B, C, D, E, G we usually don't see it. We usually don't see the G, but it's a higher infection. So that means what? You go to like undeveloped country, usually you will get it, like what I say, like India or like South Africa, some part of here. So that's why sometimes, unfortunately, you will get hepatitis G. Okay, usually you don't need to worry about in the well-developed country like in the United States. We don't need like it. We don't like this. Even we have a homeless people. Usually they don't have a hepatitis G. Not really. You need to worry about A, B, C, D, E. Okay. So hepatitis A, highly recovery. When they recover, that's fine, no problem. And the hepatitis E, if they completely recover, also is not going to be contagious. It's not a problem. Okay. The problem is the B, C, D. Okay. So higher mortality rate than the hepatitis A, and progress is chronic, and also improve in the 2 to 3 weeks. But B, C, D, unfortunately, is all blood-related hepatitis. Usually, it's very difficult to treat, especially B is no treatment, just prevention. If you do have a hepatitis B, and we just use the medication and to kind of like make yourself symptom better, but it's not totally recovered. All right. Here is a jaundice. Okay, this is a hepatitis with a patient's liver. You can see lots of bubble. That's a bubble there. Okay, it's different. The cirrhosis become hardness. Okay, it's ugly. But here you can see lots of bubbling. So that means the virus is kind of like infect and then making each of a part of a liver becomes kind of bubbling like surface. And this is jaundice. And you can see even the patient skin color is dark, like a Hispanic or like a American people. They have dark skin. But you also can check their eye. Okay. That how you say this part? The white part, Sakura. Okay, you can check this part. If this is jaundice was showing on this part, okay, and this is the white people. Of course, you can see their faces become like yellow. Okay, another way you can assess is the oral. Inside the oral mucosa will also showing some kind of yellowish. Okay, this is the oral nursing assessment. Okay, and this is another hepatitis you can also see. Okay, I put a 3 picture for you. It's easy to see. Okay, the last lecture is abscess. So the liver is all actually some kind of like a organ will get affected also very easy. And unfortunately, when the liver just get damaged, you will have a created abscess. Okay, do I have an abscess picture? I think I do. Yes, like this. The abscess is kind of become like a bacteria infected. That's why I have an abscess here. Okay, so abscess in the NCLEX doesn't really asking a lot because the treatment usually, even from the beginning, is kind of easy. We just give antibiotic, just antibiotic by the doctor's order. Okay, the management is very easy, like a fever, abdominal pain, tenderness, weight loss, or something blah blah like this. Just like exactly like a liver nursing management. Just different thing is because including one more is infection control because it's affected by the bacteria. That's why patients have a fever and chill. Okay, you see all this liver disease before, like a liver cirrhosis or like a cancer, something blah blah like this. They may not have a fever. That's why we did not put a fever there. But abscess because it's affected by the bacteria. That's why usually they have a fever infection site. All right. Also, because it damaged the liver, that's why liver is not produce the enzyme or like a bile salt or bilirubin digest very well. So that's why you can see some kind of like a bile salt is not increasing very well. That's why also become like a clay color stool. They do not die. They don't dye the stool. That's why it will become like a white color. And a dark urine because all the bilirubin and the bile salt is leaking out to your blood vessel. So that's why carrying land mixed with the urine. That's why urine become like a dark color. Okay, so we can do the ultrasound and CT scan and also liver biopsy. We can check it. Okay, the abscess, and this is you can see by the by yourself, complete with all the antibody. Okay, usually antibody for the liver will be longer, like 4 to 6 weeks. Okay, so that's why from the beginning, patient maybe like for the first couple of weeks need to be in the hospital. When they stabilize and no longer fever for a couple days later, they can discharge. Still continue with the oral antibiotic. Okay, and this is an abscess, so that's why we cut it inside. Is all like a pus here. The pus. Sometimes if a doctor want to do something like a surgical intervention, so they will put a tube inside the abscess, will drain out with all this pus. Okay, sometimes the doctor will do that. All right. Okay. Any question? This is just only liver. There's lots of things I didn't put it because it's a RN label, so that's why you don't need to know.
No.
No? Okay, good.